We talked in the last video about some causes of sleep disturbances or sleep issues, and now I want to talk about some ways that you can get a better night's sleep. So first of all, establish a consistent sleep schedule. Go to bed and wake up at the same time every day, even on weekends, and consistency helps regulate our body's internal clock, the circadian rhythms. It's very important that we do this. The next one is create a relaxing bedtime routine. Develop a calming pre-sleep ritual like reading a book, taking a warm bath, practicing relaxation exercises. I have a ritual, I guess I would call it, of washing my face and all of the creams and night creams and things that I use. And then I even have a warm face mask that I put on. It's about 10 minutes and it really calms me down. And while I'm laying there, I think of all the things, at least 3 things that I'm grateful for. They can be little things, just getting me home safely, having a good day on the golf course, having a really nice meal with my husband, just simple things that make me feel grateful and make me feel joyful and make me feel calm and relaxed. And then I'll usually read a paperback book or a hardcover book in bed. I don't like to read on my Kindle or on my phone because I want to stay away from electronics. And I read for a half an hour or so, and that calms me down. And then I can fall asleep. So we should also optimize our sleep environment. So we should make sure that our room is dark and quiet and at a comfortable temperature, not too warm, not too hot. Some people really like leaving their bedroom window open a little bit, and we're lucky we live at the end of a small town, and so I can leave the bedroom window open and we don't hear a lot of noise. Now, when we go to Florida, we're very lucky. We spend 3 months there, and I love to hear the ocean noise at night. It really calms me down. But my husband doesn't like it. It sounds like a storm to him, and so it doesn't calm him down. So I go to bed earlier. Luckily, he stays up later. I listen to the ocean, and then when he comes to bed, then he closes the window, and then we both get what we want. But it's important that you also invest in a comfortable mattress and a pillow that supports your sleep position, because when we think about it, we spend almost half of our lifetime in bed. So we should really be comfortable and get some nice blankets, some nice jammies, things that make you feel comfortable and soft and just comfy. Limit your exposure to screens before bed. Reduce screen time at least an hour before bedtime, as the blue light from phones, tablets, and computers can interfere with the production of melatonin, and a hormone that regulates sleep. So it's really important. And if nothing else, if you have to use your phone or computer, it's really important that you have a pair of, if you wear glasses like I do, these are the blue light glasses. And so they're much better for the lights that I use. Around my computer, I have 3 lights surrounding me, and it also is good for screen time. So I always wear these at night for sure when I'm working on the computer. It's important to watch your diet. So avoid large meals, caffeine, and alcohol close to bedtime because they disrupt our sleep, and opt for light, healthy snacks if you need something. Exercise regularly. Engaging in regular physical activity promotes better sleep, but don't do it close to bedtime. If you can do it first thing in the morning, that's the best. I like to walk at least before noon. Then I still have lots of energy and I feel like going farther and faster. I do walk sometimes after dinner. At an earlier video, I think I told you that if we walk just 5 minutes after a meal, that really gets our digestion going, and it's less likely to turn to fat. So I will walk around the block sometimes after dinner, depending on how light it is out. We should really, again, practice managing our stress and anxiety, because stress reduction activities such as meditation, deep breathing exercises, muscle relaxation, yoga, all of those calms our mind before bedtime, and then that calms our body too. So we should limit our naps. It feels counterproductive because if we don't sleep at night, we think maybe if we get a nap in the morning, that will really, or in the afternoon, that will help. But actually, if we do feel we need a nap, keep it short, 20 to 30 minutes at the very most, because that does interrupt with our night's sleep. And if you're like me, if I fall asleep and I sleep longer than 30 minutes, I feel really druggy and don't feel good at all. So I try to avoid naps altogether. And the other thing that I learned from my sleep coach, which you'll get to meet if you take the Ultimate Health Quest. She's amazing, and she's going to answer some questions and talk about better ways to sleep. And she is the expert. Trust me, if you really have some sleep issues, she's the one to contact because she's just amazing. But anyway, she also says it's important to remember that even though you're not sleeping, you are resting. And so calm yourself down and stay in bed if you can. If you really can't sleep, especially if you're keeping your partner awake too, it's better to get up and to do some things and some relaxation, some exercises, relaxation exercises, read a book, do some of that stuff if you can't sleep. Don't go work on your computer. Maybe if you need to write something down, that's good. I ask myself 3 questions. Is there something I can, first of all, am I safe? Is something going to happen to me right now? And can I do anything about this right now? And that really helps me calm down, because of course I can't do anything about what my mind is going through right then and there. So it's much better to just try and let it go. Some people, it works to write their fears, their anxieties, their stresses down on a piece of paper. They crumple it up and then toss it away. And that helps psychologically to help us calm down. We should manage our exposure to natural light. So get exposure to natural light during the day, especially in the morning, because it helps, again, regulate our body's circadian rhythm, that internal clock. If you can get 5 to 10 minutes of sunshine without any glasses, without any sunscreen, without any hat, and just let the sun shine in your face, it balances the circadian rhythm. It's just unbelievable how it works. Trust me. Now in the Northern Hemisphere, the sun doesn't shine a lot in winter, but if it is shining in the morning, even if it's very cold, get out and just let that sun shine on your face. It's amazing what it will do for your sleep. Mind your bed clock. Turn your clock away from view to prevent clock watching, which can increase anxiety about not sleeping. Some people just have to have that clock. I don't need it, but it's better if you can turn it around. And then there's some cognitive behavioral therapy. So it's a structured program that can help you change your thoughts and your behaviors that contribute to your sleep problems. And that's what my friend Carol will be talking a little bit about. If your sleep issues persist, again, also consult a healthcare provider and find out what are the underlying medical conditions. If there are no medical conditions, I can certainly work with you. We'll get to the bottom of what those are. And trust me, I have clients that have used supplements, herbs, relaxation activities, built in all of these things, and they are sleeping better. So it does work, trust me. I want to talk just briefly about medications, because medications for sleep should only be used as a last resort and under the guidance of a healthcare professional. They can be very habit forming, and their effectiveness diminishes over time. Even the over-the-counter ones can have a severe effect on your kidneys and your liver. And so, but I want you to remember that improving sleep habits may take time, and it's essential to be patient and to be consistent with these strategies. And if your sleep issues persist or worsen, like I said, talk to a doctor. You may need to have a sleep test to see if you have sleep apnea. But if they can't find anything physically wrong, then definitely consider some of these activities that I recommend. And what I can do is help you set up a plan that can last, that will work weekly for 12 weeks. And then by that time, you should be able to change some of your habits. Trust me, it's worked for me. It can work for you. Talk soon.